So Peggy said the volume of neonates is pretty small, so we won't spend a ton of time on that, but I will touch on it, especially in relation to the circuit size and HMEs that you would use. The other thing I want to talk about before we get started on the vent is securing the ET tube. So how many of you have secured an ET tube for an infant or for a pediatric? And so do you have a preferred method that you would use?
I choose pants.
Pants, that's what Peggy said. So I think basically you guys are doing the same thing that we're doing. I just sent Peggy a video from Open Pediatrics, which is similar to the Vermont Oxford Network for neonates. It's just this large conglomerate of physicians, and they've sort of come to a consensus as that's the approved way of securing a tube for a pediatric or infant patient. YY method is finding a corner of the mouth, taking your tape, cutting it in half, almost halfway down the tape, going over the lip, going under and over the tube, staying in one spot. And like I said to Peggy, like if the tube is supposed to be secured at 8, you're gonna tape right at 8 on that first piece. The second piece, you go over the lip, and then you go around the top, and then go up the ET tube so you have some more traction on the tube so that it'll be firmly placed. And then usually one more piece of tape goes over it just to kind of secure and make sure that it's good. And I mentioned to Peggy, there's 3M micropore tape, which is what you guys used during the pandemic for proning patients. That works really, really well, so I would recommend having that in the ER available for you. Because securing the tube can also be one of the kind of the scariest parts of the whole procedure. It's worth mentioning ambu bag size. I always tell people it's like you don't have to freak out when you have a kid coming in. Just look at your ambu bag. On the bag, it tells you what your tidal volumes are, and so you don't have to worry about. Almost every infant to 3-year-old is going to be an infant bag, and then above that will be a pediatric size bag. But just look right on the bag itself. It's there. It tells you what the bed space is. It tells you what the tidal volume is. So you'll be good to go. More? Good. So moving to the ventilator, we have standardized using the infant circuit for Hamilton for patients that are less than 10 kilos. So anyone that is less than 10 kilos can go on the infant neonatal circuit. Anyone that's greater than 10 kilos can go on your standard adult circuit. So it's a pediatric adult coaxial circuit. But 10 kilos is the cutoff that we use. So anything less than 10, we'll go on this circuit. You guys have been using the Hamilton for a while. We don't have to go over a ton of parts of the Hamilton, but we will talk about the differences with the circuit. Something that I like to point out that can be challenging is that when you get the neonatal circuit, pediatric circuit, the exhalation valve comes in a package where this is lined up like this. You're like, how the hell do I get this on here? And it's impossible unless you take this off. So you just take it off and then you attach the exhalation valve without having that part on, and you can secure it again afterwards.
Do you use filters?
What was that?
Do you use
Yes,
filters?
yeah, I actually have filters on there, but I didn't put them on. Sorry, but yes, we do.
So you're saying take the exhalation valve off that comes with the circuit?
Yeah, so when the circuit comes out of the package, this will be lined up directly like this. And when you
Okay.
try to put it on, you're not gonna be able to reach. You want to access back there.
Okay.
So you can just this part just comes off.
Okay.
So it's not like, it actually takes a little bit of muscle to get it off, but it helps out a lot. And it's one of those things that I've, been in one of those situations where tensions are elevated and you're like, how do I get this darn thing on? It's like, just alleviate that problem, take it off, put it in. Another thing to think about, and this may have happened to some of you before with adults, the exhalation valve, this piece can come off, and if you don't happen to see it and you put it in, well, guess what? It's not gonna work. So just always make sure you're paying attention to that. That actually happened to me in a pediatric case, and it was incredibly frustrating. I'm like, why isn't the circuit working? And then I found the piece on the floor.
Okay.
Do you have 2 filters that we can just put on so that we can see?
Sure. Yep.
If we were to watch this, we know that it's there.
Yep. I actually have 2 that came on the circuit you guys had on before.
So would that give you the space? Like if that was attached in between, would you?
You have to take it off
Have to put
anyway.
it on first anyway?
Yeah.
I'm not sure. We don't normally put a filter on our exhalation side.
Yeah.
We put a filter on our inhalation side.
Okay.
But if you guys want to have it on both sides, I don't think it's a problem. Hey Bob, how are you today?
Good, Tom.
All right, good. I think actually, now that I think about it,
You know what I mean?
It's
So wouldn't
in
that give you the
reverse.
space?
I don't think you would still have the space because
Okay.
you would still have to be, and you guys, if you had.
And still put it in a twist. yeah.
Exactly, yeah,
Okay.
exactly.
Okay.
So, your patient has come in, you're prepared. I'm guessing, do you guys try to have a second person? I guess if you're in Sanford, you're probably not gonna have a second person, so you're gonna be sort of having to do all of these things. So if you have time to get your circuit set up ahead of time, you're thinking, how big is the kid? They're less than 10 kilos, I'm gonna be going to my infant neonatal circuit. And then you can go ahead and get it set up. The rest of the circuit is virtually identical to the adult circuit, aside from it not being coaxial, but that part doesn't matter so much. You still have your pressure lines, you still have your flow sensor, and you still have your exhalation valve that are all basically the same. When you get the package, you're gonna notice that there are separate packages. So one package will have the actual circuit, the separate package, a smaller one like this, which has your pressure lines, and it also has the flow sensor adapter to be able to turn it back and forth. Don't lose this piece. If you lose this piece, you're in a bad spot. You have to open a new circuit. And then also in the bag is this NCPAP bag. You do not need this for any kid who's invasively intubated. So you can just take this, set it to the side. You're not missing a piece of your setup, just set it to the side. And it's labeled NCPAP, so you should know that it's not something you need. So this is saying wrong expiratory valve because right now we're in adult pediatric. So we're gonna go over to neonatal. And again, this is in reference to anyone that's less than 10 kilos. You're gonna switch over to the neonatal. Because you're using the neonatal circuit. And so the vent is gonna keep telling you it's the wrong expiratory valve if you've not switched over to neonatal.
Sorry, Tom, I couldn't see. So when you turned it on, it